And the next question is from Iain Fergusson. How do you account for the knowledge or lack of knowledge of your respondents? Which is basically a question of who are our experts, who are our respondents. For example, in the United States, the vast majority of extrajudicial killings victims are men, but no respondents identified men as an at-risk group there. Chad, do you have a comment on that? I mean, the overall, the basic question is, who are these experts, and are they experts, and what do we know about them?
Sure. And so, I mean, this also ties in with a couple of questions below that other folks have asked about, you know, other identifiers. And so to begin, our human rights experts are people who work either as human rights advocates or human rights practitioners for a non-governmental organization or something along those lines, you know, trying to monitor human rights practices. Or they could be human rights lawyers who work on human rights issues within the legal system within their country. Or they could be journalists who work on human rights related issues. And finally, they could be members of national human rights institutions if those institutions have been deemed independent of government by, you know, according to the Paris principles at the international level. And then for a few of our countries in the Pacific expansion with populations under 120,000, we did allow participants who were not politicians, police, or military, but who worked with or for the government to be respondents. And we've actually marked those on the rights tracker. But the way we get those respondents is via essentially going to trusted partners in each country where we started with, as well as our ambassadors that are located in each country that work to recruit respondents that work in these areas within the country and get them into our survey. But I actually think that that doesn't mean that every, you know, every single potential at-risk group is perfectly covered. So I'd like to actually turn away from who our respondents are for a second and talk a little bit about the interpretation of those people at risk data. So certainly if a group is highly selected in those people at risk data, we can say that that group is at risk for violations of that right. But just because a group isn't selected or is selected by a small number of participants doesn't mean they're not at risk. I would say that in some ways, if there are issues where you know, hey, they're not talking about that in the people at risk area, and I know that that's an issue in that country, then what that probably tells you is that we're not getting enough reach into that part of the human rights practitioner community yet. And what we'd like you to do actually is reach out to us and tell us, you know, who we should be talking to and who we should be contacting on those issues. So this is, you know, I think part of our growth as an organization each year, we have added more and more and more respondents to the survey, but I still think we're short of a critical mass in a few countries where we're falling short on you know, one of the things that comes up in a couple of the questions is on people with disabilities and mental health issues, right? And if you look on our rights tracker, we do have, you know, a area for people with disabilities and where they appear in those word clouds, but I think they're still underrepresented among groups compared to what we actually know the level of sort of experience of rights violations currently is. So you know, I think this is all part of our growth as an organization, but in the meantime, I encourage you to use those people at risk data to draw your attention to the things our respondents themselves were focused on, but not to use them as an overarching overall indicator of every single group that was at risk for violations of that right, because it just doesn't do that yet.
And just on that very specific example that you raised, Ian, you might just like to check out the people at risk cloud for extrajudicial killing, not just on the people at risk tab, but on the safety from the state tab. And you'll see there's the qualitative data underneath it. And underneath it, it does actually say men and boys, you know, it has come through in the qualitative data. So it's always worth just checking all of the tabs to get all the rich information there.